So we're going to touch on hygiene just very briefly. There are some phenomenal hygiene lecturers here at this event, and I'm sure a lot of you have had an opportunity to see them. They're just terrific. We've seen a couple ourselves, so very impressive. But our top priority for every dental hygienist that we work with, the most important thing above scaling and reviewing health histories and taking x-rays and all that stuff, the top priority is creating value. That should be every hygienist's #1 objective as they start a visit. To not use minimizing words. It's never just a cleaning. We want to use words that are much more powerful than that. Unfortunately, a lot of our offices in the Northeast, we had terrible weather this winter. It was really a killer. Some practices lost 5-6 days. I don't know if any of you have encountered that type of weather from where you come. But that coupled with the fact that people just seem to be a lot less reliable in general, the hygiene schedules were getting blown out all over the place. And when we start to work with hygienists to improve the level of perceived value of those hygiene visits, we start to see those cancellations and no-shows and last-minute changes, which are, that eats up so many resources when we have to re-engineer that schedule because we had all those last-minute changes. We see that really improve when we focus on increasing the perceived value and having patients understand that it's not just a cleaning. Try to remove that phrase from your terminology, from the things that you say. It's never just a cleaning, it's so much more than that. And hygienists, you do so much more than clean teeth, so remember that too. One other thing that we're going to talk about when it comes to value-added services and things that we should do because we want to make a difference in people's lives, I want to talk about oral cancer screening, and I'm going to try to keep my story short, but I will tell you that my dad is a stage 4 tonsil cancer survivor. He was diagnosed about 4.5 years ago with a little bigger than a golf ball, not quite the size of a tennis ball, cancerous tumor on his right tonsil. And he had some chemotherapy and radiation, and he had a radical dissection, and he had a feeding tube and a tracheostomy. And very sadly for me, my dad has not been a great dental patient his whole life, which has always been sort of a thorn in my side because I love dentistry, and my dad's one of those people that didn't really go unless he had a bad toothache. The really sad thing for me is that had a dentist or a dental hygienist looked in my dad's mouth, they would have found that tumor before he had to go through all the things that he went through. So thank goodness my dad is alive today, but it is a fact that he will die from bone, brain, or lung cancer. It's a fact. So we have that to deal with now. So just remember that the purpose of what we want all of you to take home is to make a difference in people's lives. We have the resources and the tools now with all of the oral cancer screening devices that are available. If you're not using them, it's a big disservice to your patients. Start. We don't care which one you pick. They're all really great. But educate yourselves about the risks. Educate yourselves about the fact that it's not just smokers and drinkers. It is so much more. So please put that on your action plan and take it back with you and start doing oral cancer screenings at the highest level that you can.
How many of you have intraoral cameras in your offices? How many of them use it on every single patient? Good. All of those who did not keep your hand up, I want you to make a pledge that on Monday you will start using it on every single patient. It is the most valuable tool we have in partnering with our patient in co-diagnosis to inspire them to seek dental treatment.
And also in insurance payment, I mean, if you're working in the world of insurance participation, intraoral photography will change your payments. It will absolutely improve the way that you get paid. So for a variety of reasons, some that are very patient-focused and some that are very focused on what benefits us, you have to do it. You must have it.
When patients see pictures like the ones on the screen there, they know that that's not right. And what they look at those pictures and saying is, can you take care of that? Can you change that for me? Because I don't want that in my mouth. The other use of a camera is sometimes to show them the things that are good that we see in their mouths. Maybe some successful treatment. Maybe just looking at a tooth that makes you happy.
Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do.
And also, I just want to remind everybody, speaking of being happy, Woody invited everyone to go at 4:45 today to Hammerheads for happy hour. So let's do it. We'll see you guys there. The retracted smile photo is something, again, show of hands, anybody taking the retracted smile photo on a regular basis? Oh, a couple of hands. Awesome. Okay. This is, again, coupled with the intraoral photo, one of the best things that you all can do to increase your case acceptance, increase your patient's level of understanding without trying to educate them about all the things we already know, which we will not teach them in a matter of minutes. This really allows them to become connected, to have a level of co-diagnosis, and to take ownership of the problem that's in their head. It's not our problem, it's their problem. So please, if you're not doing this, start doing it as soon as you get back. And there are so many great point-and-shoot cameras. You don't need to spend $2,000 on a fancy camera. With the technology that we have today as far as cameras go, you can do this probably with a camera you already own. So don't make excuses, just start doing it. And the periodontal progress report. This is also in your handout. The one that we've given you here has no header on it, and it is ready for you to customize. If you would like for us to send this to you in an electronic format so that you can customize it more easily, please send us an email. We will send it. So car dealers, service departments at car dealerships have done a wonderful job about increasing our perceived value. So you can go to a Jiffy Lube or a Quick Stop or a place like that, and you can get an oil change for like $29. However, when you go to your car dealer, they'll usually charge you like $65. And what the car dealers have done that is so interesting, and we need to pick up on it, the periodontal progress report will help you with this, is they will itemize every single thing they did. They're really good at increasing the value of their service by listing all of the value-added services that they did for you. So on that periodontal progress report, you're really partnering with the patient. You're going over with them all of those things that you've done for them every single time that you don't get any credit for and that they don't really understand. And it's also giving them an opportunity to take that home and review it. They clearly understand what happened today, what's happening next time. And there's a whole administrative component to this form that I'm not going to go into much today, but please, if you're interested, come up at the end and I'll go over that with you. It's a great last-minute cancellation tool. The treatment presentation, if you do not have a consult room, we really encourage all of you to figure out a way, maybe if it's the doctor's private office, or if there's a little nook and cranny area in your administrative area that you can turn into a consult room. We do find that patients really hate having treatment presented to them at the chair side unless it's a true dental emergency. They are very uncomfortable in that dental chair, and most of the time we kind of sound like the Charlie Brown teacher. They're not really listening to us. It's like, want, 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 want. They're just thinking, oh my goodness, get me out of this chair. I don't want to be here anymore. So if you can present in a consult room, your case acceptance will go way up. Your patients will have a different level of the way they feel you respect them. So that's very important.
Everything we do within our practices should be geared towards increasing the perceived value, of giving a level of service that patients have never experienced before, of making them know how much we care, much more so than having them care how much we know. Certainly we want to make them feel that what they are, because of the level of care they're receiving, that they're going to want to refer others, that they're going to want to come back to continue with their treatment, that they're grateful for the service that they're getting. As we increase the level of perceived value, we lower in their minds the level of perceived cost, because people see value. As we ask patients if their main concern is the cost of treatment, many of them will state emphatically that it is more the concern for value and that they're getting their money's worth. So whatever we can do to raise the perceived value will, in the patient's mind, lower the perceived cost.